Well, is the state of Indiana responding fast enough to identify these potential cases of coronavirus?
In fact, that's what some Hoosiers are asking tonight after they tried to contact the state health department and they got no response.
13 Investigates has been digging today to get you answers. Our senior investigative reporter Bob Siegel explains how long these families have been waiting.
Have just signed and declared a public health emergency.
It was just about 11 o'clock last Friday morning when the governor made that announcement, and state health officials asked the public to report cases of suspected coronavirus. Less than 3 hours later, the Indiana State Health Department got a message through a special email address it set up on its website, specifically to alert state health officials about possible cases of COVID-19. A woman writing the health department expressed concern that she contracted coronavirus 2 weeks ago while attending a work event with people who had recently traveled to Europe and Asia. The woman started feeling sick a week later with a 103-degree fever, cough, and tightness in her chest. And she said her elderly mother has now developed the same symptoms. The woman who contacted the health department does not want to be identified because she fears retaliation from her employer. But she does want to raise questions about the response that she got from the health department. She instantly got this reply, saying the health department would respond to the message soon. But the automated reply also said email messages to the state's coronavirus call center are monitored only during regular business hours, 8:15 to 4:45, Monday through Friday. Despite receiving this message early Friday afternoon from a woman worried she and her mother are showing classic symptoms of coronavirus, the health department did not reply on Friday or over the weekend or even today.
And we will deploy all steps needed quickly to protect Hoosiers.
Despite a sense of urgency from the state health commissioner, this tip to the state coronavirus call center has gone unanswered for more than 72 hours. And over the weekend, other Hoosiers who feared they've contracted coronavirus told 13 Investigates they could not reach the state health department either, and their calls to the department's coronavirus hotline were either unanswered or they were told to call back during normal business hours.
If you are calling about novel coronavirus, please press 1.
When I called the state call center this afternoon, it did ring for several minutes before an operator offered to take a message. She did not know how long it might take to get a return phone call for callers who think they might have COVID-19. Further evidence, the state health department's coronavirus response might be understaffed, something the state health commissioner seemed to suggest last week.
We need resources with regards to a call center because our call center is very, very busy right now.
By Monday afternoon at this press conference in Avon, the health commissioner acknowledged extended hours and more staffing is on the way.
We are adding to that call center from 8 to 8. We'll also be adding another shift from 8 in the evening to 8 in the morning to get additional help.
This afternoon, the state health commissioner told us Indiana's coronavirus hotline is getting lots of calls from concerned residents, but she insisted the hotline is not overwhelmed. If that's the case, it's still not clear why families making actual reports of suspected coronavirus can't get any response from the health department. Here are the hotline phone numbers and the email. Again, it's unclear when or even if someone will get back to you. We will keep asking until we get answers. And Scott, just a few minutes ago, we got a statement from the health department saying they are going to staff the hotline 24 hours a day now moving forward.
The woman, though, in your story who wrote the health department, has she gotten an answer yet?
She still has
waiting.
not heard a word, and she's most concerned for her mom,
of course,
who has the high fever. That's, she's elderly in a much higher risk group.
All right, Bob, thank you so much.
You're welcome.
Well, we've posted all this information for you. It's on WTHR.com/coronavirus, and we want to make sure that tonight that you have all the facts and not fear.